So I use Botox in the face and body. It can be used for frown lines, forehead lines, crow's feet around the eyes. It can even be used underneath the eye to open up the eye. It can be used for spasms, including blepharospasm, if you've got a twitch in your eye, for example. It can be used for bunny lines in your nose, when you have these vertical lines that develop for people who kind of scrunch their nose. It can be used for people with flaring nostrils to relax those muscles around the nostrils. It can be used in terms of raising the tip of the nose. It can be used to lower any big gummy smile line. It can be used to prevent chin wrinkles from forming. It can be used to also encourage the jawline to tighten up by doing the neck. It can be used as a preventative method for migraines, and more commonly, because I'm a dentist, I see a lot of patients with temporomandibular jaw pain, clenching, grinding, really overworking those muscles. In terms of the face, we have 4 major muscles of clenching and grinding, and the 2 biggest ones are the masseter and the temporalis muscles, which, like any muscle, if you overwork them, clenching and grinding, will increase in size. Now, the point of Botox is to not stop you from grinding at all, because we need to actually chew our food. We need to function in life. It is to reduce the strength of the muscles. So we specifically place the Botox in the masseter and the temporalis muscle, which are only 2 of the 4 major muscles surrounding the jaw joint. And that really helps to just relax things a little bit for those who are really clenching and grinding. This is very common for people who clench and grind at nighttime, and it will always be used in an adjunctive with preventative dental procedures, like giving you a night guard to protect your teeth from any damage or wear. So that's a really, really common thing that I do in my clinical practice. But in terms of medicinal uses of Botox, it can also be used for sweating, underarms, feet, hands, palm of the hands, forehead. So Botox, don't forget, is targeting muscles. Now, around every sweat gland, you have a tiny little muscle which is controlling the sweat gland. And by using Botox to reduce the action of the muscle controlling the sweat gland, we will reduce the amount of sweat that comes out from that sweat gland. Now, this is not to say that we won't sweat at all. Of course you will, but we are just reducing the amount of sweat. So it's really, really useful in the summer for people who feel like they're constantly wet no matter what deodorant they use, for people who to drip on their forehead when they're looking down, or people with really sweaty palms, for example, and in interviews when they're shaking hands, they just feel like their palms are constantly sweating. I put them in the palms. You can put them in the soles of your feet. So it's a variety of different uses for Botox.